Hello there, I'm Miranda Gretton, and this is Take a Moment with NCHC, the show where we talk to you and your colleagues about experiences that affect you. Listen on your drive between patients or in your downtime, whenever you get the chance to take a moment.
Hi, I'm Rob. I'm a nurse assistant practitioner in the City Learning Disabilities team.
Tell me a bit about your role at the Trust.
My role originally was as a healthcare assistant. I then progressed to a nursing assistant practitioner. Main aspects of this role supporting clients with their health needs, including health appointments, health advice.
One of the specialities that you focus on in your role at the moment is male sexual and physical health. So, how do you apply your knowledge of that topic to this role then?
The reason I sort of wanted to focus on male sexual health, male health, tied into my time, I used to work at the Norfolk and Norwich, and one of the roles I had there was working in the genitourinary medicine department. There was a lot of sort of sexual health education, a lot of advice, and we'd see many patients come in who would, sort of maybe not up to date with safe sex and the practices of this and STIs, other such things. And part of me thought, we didn't really see many people with a learning disability in the clinic. You might get the odd one too, but it wasn't something that was really that regular. And I was thinking, people with learning disabilities, they still go out there, they still have sex, they still have relationships. And, it's just something that is very important to me, very precious to me, is that there is that education out there. I really want to make that my speciality. So, if referrals came through for somebody, with sexually inappropriate behaviours or relationship advice, someone who might be on the brink of becoming sexually active, my role would then be to go out and using resources as well, is to sort of talk about relationships. What is safe sex? Is sex actually what you want, or do you feel it's something that is expected? Tying in with that as well, the men's health part, I gave a presentation during lockdown from an advocacy group called Opening Doors, and that was around male health. And I found that really, really good as well. It was a really great opportunity for me to sort of meet the guys at Opening Doors. And it was discussing male health, including checking your testicles. And again, that's something that a lot of male clients I've worked with maybe aren't so aware of. It was being fed back as well. This discussion was brilliant, and it was like, what do you do if you find a lump? And like a Q&A and really getting it out there from a man's point of view and looking at things that I'd question my own health. And with clients with learning disabilities, they might not have given that a thought. General populace don't always, there's a lot of people who think, oh, it's okay, grit your teeth, I'm a man, bury my head in the sand, it's fine. So if I can advocate and just support anybody in that way.
It's amazing work. And I mean, I guess you must have to work quite closely with families and carers as well to increase their understanding.
We do, yeah, there are instances where there's family input as well, or the family member might have the concerns. It's obviously with the consent of the client each time. So if the client says, I don't want to talk about sex with you, mate, fair enough, it's the person's right to say no. But they can help, sort of, and with carers as well, there can be that guidance. Certainly carer support as well, people in supported living, the carers that know the clients really well, and they can encourage, like with the checking of testicles, when you've had a shower, have you checked your balls today? Those little things, there can be prompts, and they can sort of come off the back of the initial work. So yeah, so family care input is valuable.
You said before at the beginning about working with a multidisciplinary team. So, how do you kind of spread what you're doing, the good work that you're doing, and the knowledge that you have, and all of that questioning with patients? How are you kind of making sure that other people in the MDT are picking up on those things as well?
I mean, it would be a discussion with anyone involved. So if there was like psychology input, other nurses involved, that would be fed through. So what I'm doing, what signposting, and in my role as an assistant practitioner, obviously, sort of it would be a discussion to say, is this the appropriate action as well, not just to go gung ho and say we're doing this, we're doing that. And things like sexual health clinic advice I can provide, and we have iCash in Norwich who run an excellent service, and there have been instances where I've referred clients to go there. And if they need support, it can be nursing support or their carer, someone they're comfortable to go with can support them with that. And we have easy read resources about going to the sexual health clinic as well, which takes that fear away a little bit, And so I think the important thing, and this is advocating for our clients as well, and just ensuring that they haven't got that fear and that nervousness, same as any other health appointment, is to really explain that, social story, easy read, anything at all that's there that explains what a gum clinic does. But it would be shared. We have a Teams channel, so there's a sexual health channel, and I'm linked for the whole LD service at the moment. And people come to me for resources. We can discuss. So all the work that I do. So it's for the good of everyone, every team within learning disabilities, not just City. So every team.
You're absolutely right in that, people with an LD need to be supported because they don't necessarily have the access to that information. But you said, you said yourself that the general population are pretty bad at it as well.
Mm.
Do you find that you come across men just generally, in your life who aren't particularly good at checking themselves or making
Yeah,
sure that they're looking after themselves,
yeah, certainly. Yeah, male friends, people to speak to, even like family. When you give them that little bit of advice when they're a certain age. And yeah, there's sort of that perception, when do you check your balls? That's the key thing is, when do you check your balls? Oh, every so often. How do you check them? And I just touched down there. And it's those things. So that education, I think, is something that needs to be more mainstream as well, not just focused on learning disabilities, but really out there. I mean, there's the brilliant drive on prostate cancer, which is fantastic. Promotion on there, social media has obviously taken hold of that as well. Lots of great work going on there. But I still think sort of checking your balls and testicular health, men's health as a whole, is something that maybe needs more promotion or just, more awareness.
we don't talk about it enough. It's like people are scared to say the words, testicles, balls. It's
Mm.
the same for women. Often scared to talk about their periods or the menopause. There's all these words that if you say to certain people, they sort of they wince.
Yeah.
Oh my goodness, can't believe you're talking about your testicles. And it's like, but hang on a second, that could save your life.
Yeah, absolutely. I mean, men more likely to talk about the football in the pub, aren't they? Instead of saying, "Have you checked your balls today, mate?" It's just something that doesn't come up in that sort of conversation.
What are your thoughts on men's mental health and how it links to men's physical health?
I have sort of had my own issues with anxiety in the past, and I think my thing was being typical bloke was burying my head in the sand for a very long time, thinking, "Oh, it's probably my heart. I'm getting this tingling, chest is racing. I'm maybe being a little bit irrational." But it's kind of identifying, saying, "Right, okay, something's not right. I need to see a doctor, or I need to get that help." And very much like with the testicular checks, it's having that I'll use the phrase having the balls to actually do so and say, I'm not well or something's not right. The learning disabilities team management were great when I suffered with this. Regular contact, support, ensuring that I went to the GP, that I took every step necessary. And without that support, again, I think that would have been difficult. But certainly, yeah, I mean, I'm in a great place. I've been for a few years now, fantastic place. And yeah, so I'd say with men's health, men's mental health, I'd say it's really important to talk about it and also for others to identify, because that's the thing for me. And it's something I've sort of promoted in the past as well via social media is it's okay to ask someone if they're okay. You might have a colleague, male or female, but I know us men are notorious for not talking about feelings. We do like to bury our heads in the sand. We do like to say, yeah, I'm all right, I'm fine. And off you go, think, it's just kind of what we do. And when your bloke's down the pub again, like we're talking about your balls, you don't say, how you feeling? You're a bit stressed out. It's just not a conversation that you can necessarily have. Even with my own wife, it's like, do I admit that, I've got this, what I perceived at the time as a weakness. I mean, looking back, it's not a weakness, but I would say the advice I would give is if you even pick up a hint that somebody's not quite as they should be, or something, it could be work related stress, it could be anything, is just to take the time, and say, are you okay? Do you want to just sit and chat, cup of tea, and just really take that time.
Yeah, that's really good advice. And it's so interesting what you said about the physical symptoms, because I think that I have had experience of that with some of the men in my life where they've said, oh, I've got chest pains or, I've got headaches or, this and the other. And so they've gone onto Dr. Google and thought, well, it must be a heart attack or, this, that, or the other.
Yeah,
And then actually they've booked a GP appointment expecting the GP to say, oh, it's a trapped nerve or it's it is something to do with your
yeah,
it's a heart murmur or it's something physical, and actually the doctor has said, I think you're suffering from anxiety. And so even in that moment they've made the decision to go to the doctor but still thinking it's going to be something physical, not that it's affecting their mental health.
mm,
You get physical symptoms from issues
absolutely.
with your mental health, don't you?
And it really does manifest, yeah, because I spent some time thinking, is it my heart? I was sort of getting that fluttering, left hand tingling, headaches, shortness of breath, which all tied into the panic aspect. But having never suffered with anxiety before, not being an anxious person, those symptoms, yeah, they were manifesting. And it was Dr. Google, it's like, well, no, this must be, it could be my heart, it could be something not quite right. And again, we're not always great at going to the GP. We advise, we support our clients, we support everybody. Go and see your doctor. But when it comes to your own health, you think, well, just see how I get on. And again, lesson learned from that. But yeah, interestingly, when I spoke to the doctor, yeah, she'd done the GAD score, Generalized Anxiety Disorder Scale, and the boxes were being ticked left, right, and centre. And it was identified that it definitely was anxiety. the first time round, and so it was fascinating to think, hang on, this is me. I'm on that piece of paper. This is how I feel, and now I have a definition. I can do something, or I can get the help. And again, there was that work in place then that really helped.
So it's a diagnosis, isn't it? I mean, regardless of
Yeah,
whether it's a diagnosis for something to do with your mental or your physical health, the fact that you then walk out of there with a diagnosis means that it gives you a purpose and it sort of propels you forward to go and get some help. It's all those
yeah,
bits at the beginning before you have that, isn't it? When the anxiety will only be getting worse because you don't know what it is. More often than not, as well, other people in your circle are going through similar things. It's incredible. And you start talking about something that you think is a
mm,
very private, personal thing. The amount of people who say, "Oh, yeah, no, I know, I have that," or "I know someone
yep,
who has that," or "My brother has that." It's
yeah.
actually very normal.
So true. Yeah, I mean, I've got a lot of good friends, and people even sort of in the professional world, that have come forward and said, I've got anxiety or I've had it. I understand what it's like, and yeah, it makes such a difference. Because right, 'cause initially, I mean, once you get that diagnosis as well, it's sort of a little bit of an isolating feeling. You think, well, blimey, anxiety, me. And again, you think, God, this is a weakness. This is something to be embarrassed about. I think being able to speak to people as well and share those experiences, and know, that I've got male friends and female friends. It's not just gender specific. You can talk about it, and it's not embarrassing. I've sort of posted on social media some very sort of supportive posts in the past. Just sort of promoting mental health. Saying, if you've got friends, really getting that message across. If you've got someone out there who isn't okay, it's okay not to be okay, and to talk. And again, friends will be in touch. People I maybe not spoken to for a little while who are like, oh yeah, I've been through this, totally understand you, or they've shared it. And I just think it's doing good. It's getting that message out there.
It's interesting that you say it's not gender specific because you're right, it's not. But I do feel, looking at the men in my life, that men, and you said this earlier, that men do struggle to talk about their emotions. They
Mm,
struggle to go to the GP. It is slightly different, I think, for men, because if a woman is struggling with something, this isn't a blanket for everybody, but I feel like my personal female friends would turn to each other. We've got a group WhatsApp, and someone would say, "Just really struggling today," or even just turn to a friend or a family member and say that. And I feel like the relationships and the communication there is just slightly different. Whereas
yeah,
male friends, you would never know that something's going on until rock bottom.
there's one chap. I used to be a postman a lifetime ago, and he was always lively. Always a good laugh. And again, I found out via Facebook. I hadn't spoken to him for a few years. But yeah, he'd booked a holiday for him and his kids, his wife and his kids. And yeah, he's went to a well bridge and ended his life. No reason. And yeah, I don't think there was ever was. So it's just that's the hardest thing, is being able to communicate. I think that's sort of part of my thing, is trying to get that word out to say it's okay to talk, or for people to come and talk to you. Because I mean, thankfully, I didn't reach that level of rock bottom. I wasn't at the stage where I felt suicidal at any point, but I did feel absolutely awful. Bloody terrible. To put it mildly, you think, waking up in the morning's hard work, functioning during the day. Almost like this neediness as well. This need to be, I don't know, someone to be around, which is really hard to describe, because I'm not a needy person. But when you have anxiety, there's that neediness, but you don't actually want to portray that. It's really hard to sort of really just want someone to say, you're not right, are you? But it's really hard to describe that feeling.
That's really
So you're
interesting
in
because
that
you want
zone.
someone to say that, but at the same time, you're
Yeah,
not showing them that you're not all right. So that, how would
exactly.
they say
Yeah,
it? Yeah, isn't that
yeah,
interesting? I didn't know
yeah.
that about that sense that you
I
get.
would say, yeah, certainly I had that sense, yeah, that need for someone to say you're all right, because you're not yourself. You're not doing okay at the minute. But even in hindsight, even remembering what you're like, you get these little nuggets, but it's almost like your memory of it sort of disappears a little, and you come away thinking, was that me? That period of my life? That feels like someone else almost. I think it is the hiding it at that point in my life. That's how I wasn't suicidal, but I didn't want to talk about it neither. I want someone to notice me, maybe. Who knows? But I didn't want to sit there and say, oh, I feel really anxious. Oh, I don't feel right. And like you said, with the WhatsApp group, being able to talk among like your friends, I wouldn't have been able to do that, speak to a male friend, or even like my dad, somebody, and I mean, he's been great, when my parents sort of knew about the anxiety, fully supportive, in-laws fully supportive, but in your head you think, I'm showing weakness. Say, hi dad, I think I've got anxiety, I feel rubbish. I mean, it'd been amazing, but in my head, no, I couldn't do that.
It's ingrained, isn't it, I think,
It is.
in male culture that if you speak up, if you say something, that you're going to get the mick taken out of you, or
Yeah.
or someone's going to say, "Man up, don't be so silly," especially somebody like a father figure
Mhm.
who is from a different generation who never really talked about anxiety or depression or their feelings. So to then realize that when you do open up, to get that response from your dad. It must just have been so amazing.
That's great. Yeah, yeah. It's full understanding. Same with my father-in-law as well. It's just like, we get you, and there was none of that. My preconceived responses weren't the case at all. I think that harks back to the whole "it's okay to talk about it" thing, because I had a lot of preconceptions. How would people react? I've got anxiety. I'm showing this what I perceived as weakness, this mental health, again another label, mental health, and all these things that I'm admitting to myself to having, but then telling others. And I think that's why my feelings now are, that as a male who's gone through it, of a certain age as well, of a in between generation, you've got the stoicism of the older generation. We've got the younger generation who are more open about feelings. I noticed that sort of from my studies, that younger people are able to talk about how they feel and able to address things maybe a little bit better than. But sort of my generation is that kind of like we're in between. We don't talk about that, but we should be. And I'd say the feedback just from the sort of promotional work I've done myself was fantastic. Male friends coming forward, and commenting, good on you, and a lot of really good feedback. And I take that away with me and say, I'd hold my hands up. I'd never be embarrassed about talking about mental health now. Hence why I'm happy to willfully talk about this now, because it's not something that I'm embarrassed about. It doesn't define me. I define who I am. I think that's another key point as well. And anyone who suffers with anxiety, it feels like it's ruling your life, but it doesn't. It's just like any other illness. There are treatments, there is support, you can get through it.
I just think there must be so many people out there who think, someone with chronic anxiety can just
Mm.
turn it off, and
Yeah.
it's not something that
And
you
it's
can
not
do.
that simple. No, no. And I think that's one of the things, people say pull yourself together. I mean, I've never had that said to me, but you do hear it. I've heard it in other sort of places, maybe professionally as well as personally, different phrases that are used as well. And it's like, no, come on, you're not getting it, just, yeah, you can't turn it off. I mean, I battled for ages to come back to work when I first had anxiety. It was a nightmare because I just wanted to get back to normal. And I mean, amazing counselling, amazing support out there. But you couldn't just turn it off, wake up next day and say, I feel great, I feel fine. It's daily runs. I was like Forrest Gump. I was out there every day doing 3 miles a day running, just thinking maybe that'll burn it out of me, get it. But you'd get home, you'd have the high of running, exercise is good. But even then, you think, oh, I still feel not quite there. So obviously counselling, medication. I think that's another stigma, people are reluctant with medication as well. And I think that reluctance, is not a bad thing, whatever works, I think is worth doing. So if it's medication, if it's counselling, um, if you're using distraction therapy, whatever works, use it without worrying about stigmas again. If there's any way of breaking the cycle, I think my key thing that I learned, I had a former manager a long time ago explain the system of steps, and it certainly worked for me. Is when you're going up the steps, not to run up the steps because you'll trip. And so just to walk those steps, take those gentle steps. So if you're mental health, you're at the bottom, or you're nearing the bottom, just take those gentle steps up. Take your time with those steps. Not try and run and say, right, I'm back to normal. And allow yourself that time. That certainly worked for me.
Thank you for listening to Take a Moment with NCHC. If you've enjoyed this podcast, please visit the podcast intranet page to leave a comment and for details of our other episodes. You can also follow NCHC on all social media channels.